The CDC states that 130 million people visit emergency departments per year across the country. Primarily, nurses are on the front line when it comes to taking care of these patients. Today we'll examine a number of ways nurses can build a caring environment for their patient, build necessary communication skills, as well as some of the technological barriers that is associated with healthcare. NursingPracticing.com lists a number of ways that nurses can build a caring environment for their patient. These include, but not limited to, listening to the patient's needs, not rushing through procedures and assessments with the patient, as these tend to make the patient feel invaluable to the nurse. Also, sitting at eye level and speaking to the patient can also aid in opening up communication lines with the patient. To build necessary communication skills, NursingTogether.com's author Lynette Anderson, BSN, states that successful communication is composed of 3 compartments: a sender, a receiver, and a message. Nurses are often the senders of this message. She also states that it is important to use everyday language when speaking with a patient. For example, telling a patient that he or she had a myocardial infarction can be detrimental to the patient's understanding of what's going on. Does anyone here know what a myocardial infarction is?
No.
A heart attack. Simply saying a heart attack instead of a myocardial infarction can lighten up the perspective of the patient's understanding of what's going on. Being clear with the patient and honest about medications, time frames, can also aid in communication lines being open with the patient. Now let's shift gears and talk about some of the technological barriers that are associated with healthcare and nurses in general. So, technology undeniably has been helpful to humans. It's even made some of our lives better and easier. In an effort to reduce medical error, a variety of medical institutes have enlisted the use of computers, tablets, smartphones in order to keep track of patient data, medications, and so forth. But an article published in the New York Times stated that Dr. Peter of New York feels as though this is a dangerous component for patient care. Since nurses spend a large amount of time behind computer screens instead of dealing with the actual patient, medical communication often gets lost since nurses aren't there with the patient. Sage Journals conducted a survey that found that perfusionists that are responsible for operating heart and lung machines on patients that's receiving heart bypass surgeries often texted or talked on the phone while they were supposed to be on the machine, keeping the patient sustained. This, Dr. Peter states, is detrimental to patients' well-being. So, in closing, nurses will continue to be challenged with being competent in an ever-evolving technological medical state, but it is up to the nurse to strike the perfect balance between technology and a humanistic approach to opening communication lines with their patients.